Hello, this is Dr. David Green, CEO of the Arizona Pain Network, where we bring you anything and everything educational for pain management. Today the topic is a revolutionary procedure, radiofrequency ablation for back and neck pain treatment. Here's a few facts on back and neck pain. 9 out of 10 Americans will experience back pain at some point. It's the second most common reason people go to see a doctor, just behind the common cold. And it's the leading cause of disability in those under the age of 45. 40% of those who undergo back surgery may end up with failure, and that's called failed back surgery syndrome. Neck pain affects about 10% of the population at any one point in time, up to 45% each year. 50% to 70% of people have neck or shoulder pain at least once in their lives. When you look at the back of the spine, whether you're looking at the neck or the low back, what you see are these joints on either side of the spine called the facet joints, and they help to provide mobility to the spine. They do have cartilage, just like shoulder, hip, knee, and they're prone to arthritis. 45% of the time, back pain is coming from a problem in these joints, and there is no successful joint replacement yet for a facet joint. To make the diagnosis of facet joint-related pain, doctors will use a combination of history, physical, x-rays, CAT scan, MRI, and potentially diagnostic injections. Here's an example of a CAT scan of, on this side, a normal facet joint. You have vertebral body here, the spinal canal, and then look at these joints. Look how pristine that looks on both sides, okay? Now look at this one. This is very arthritic. You can barely see the joint space on this side. There's a lot of overgrowth of bone into the canal on both sides. So those are called bone spurs. So basically what you see here is a lot of facet arthritis and then really none here. But the unfortunate thing is that it doesn't matter how it looks on an x-ray or a CAT scan. It may not correlate at all with a patient's symptoms or lack of symptoms. So it can become a coin toss, and even the best trained spine doctors are wrong 50% of the time. So it may come down to a diagnostic injection, and there's two types. On the left you see what's called a medial branch block, and the facet joints, you can see them here and here, they get sensation from these tiny little nerve endings called the medial branches, and those come off of a nerve root. So it's not a nerve root, it's just a nerve ending, or a series of nerve endings. And the numbing medicine goes right around this, and maybe some steroid, and it can provide pain relief by stopping the transmission of that sensation for pain. Okay, that's one. The other one is a facet joint injection, where the needle goes right into the suspected painful joint, and that can provide weeks to months. Both of these can provide weeks to months of pain relief. So what is a diagnostic injection positive? Well, if some say it's 50% pain relief, others say 80%. Some insurance companies say 80% on 2 separate injections. It's going to vary. Medial branch block in and of itself may provide pain relief for 3 months on average, and then it can be repeated. So it has 2 purposes, diagnostic and therapeutic. And when it wears off, a person can move on to the discussion today, radiofrequency ablation. Radiofrequency ablation has a lot of other names it goes by. Neurotomy, medial branch neurotomy, medial branch thermocoagulation, radiofrequency denervation or lesioning, but they all mean the same thing. Here's 5 facts about radiofrequency. It's the same current as used in radio signals, but there's no FM radio involved in the procedure unless there just happens to be one in the room. It can be more painful afterwards than before, and that usually goes away within 1 to 2 weeks. It's due to muscle spasms. Pain relief from the procedure has been shown to be between 6 months and 24 months on average. You do need to have one of the diagnostic injections prior, and it has been a truly revolutionary treatment for back and neck pain. And what exactly does it do? What you can see here is, looking at the spine from the side, this is a facet joint. This is a nerve root coming out, okay? And you can see the little medial branch nerve endings coming off. And the procedure basically puts a catheter right around those medial branch nerve endings, and it deadens them by applying a lot of thermal energy, okay? So here's the actual procedure. It's done under fluoroscopy, which is real-time x-ray, okay? So the pain doctor knows exactly where catheters are going. And this is what they look like when they go through the skin, and you see a few of them, because usually more than one joint is treated at the same time. Initially, the catheters are put in place and there's an initial stimulation to make sure that the leg doesn't jerk or the arm, depending on whether it's neck or back, so you can make sure you're not too close to an actual nerve root. Once the placement is deemed to be accurate, then here's what the generator, one of them, looks like. But you can see it's usually 80 degrees Celsius for 90 seconds. That's the standard treatment. Okay, it will vary in other areas, some areas of the body, but that's usually, and it deadens the medial branches. The whole procedure takes about an hour, maybe less. What are the results? Well, studies show that the average pain relief is about 15 months, and it can last upwards of 2 years. It's much, much longer on average than steroid injections. It can provide patients with greater range of motion, lower the need for pain medication, and the procedure itself has a very short recovery time. There are a few potential complications. You might see increased spasm for a week or so after the procedure. In less than 5%, the pain doctor will not fully deaden the medial branch, so you can have increased pain for quite a while after the procedure. You may get some temporary numbness of the procedure site. Very rarely does the procedure cause spinal cord trauma. That's much, much less than 0.1%. And as mentioned, 15 months is the average pain relief. And studies show that if you repeat the procedure when pain returns, like if the medial branch nerve endings grow back, then you can expect the same amount of pain relief. The top pain management clinics in Arizona are Arizona Pain Specialists. There are 5 locations throughout the Phoenix greater metropolitan area, accepting over 50 insurance plans, along with self-pay, workers' comp, personal injury. The doctors are board certified, fellowship trained. They've won the Patient's Choice Award for 5 years in a row. The number to call for scheduling is 602-507-6550, and visit us on the web at ArizonaPainNetwork.com. I'm Dr. David Green with the Arizona Pain Network. Your pain stops here.